it really taught me a lot about listening to myself and listening to my body and following my instincts, because an unfortunate part of PCOS, I had mentioned being gaslighted. And I hear that story repeatedly, that people are so desperate to find answers, support, and help, and they're just turned away. They're told exercise more, eat less, eat certain foods. And it's so much more than that. PCOS is a complex endocrine condition. It's not just cosmetic. It's not just about weight. It affects every part of your body, hormonally, reproductively, metabolically, and even psychologically. Until we start addressing this as a full body issue and not compartmentalizing it into infertility or cosmetic or lifestyle, then we're going to continue to have people fall through the cracks.
As we move into PCOS Awareness Month, we thought it would be really helpful for you to get some essential information on this condition that is so difficult to understand and to treat. It's also very difficult because many people who suffer feel like they're suffering alone. So we're going to bring you both an advocate who's gone through it herself and has seen hundreds of people who've gone through PCOS treatment, and also a physician who treats PCOS. So on this week's Building Your Family episode, you will meet the advocate. Her name is Ashley Levinson, and she's terrific. She's done so much for PCOS awareness and treatment and advocacy. You will love this episode. From our Building Your Family community, this is the Building Your Family podcast. I'm your host, Lisa Schuman, author, researcher, and reproductive medicine therapist. As the leading destination for support and education for people using reproductive medicine to grow their families, we cut through the noise to provide you with research-based information, effective and actionable strategies, and the support that you need to feel better so you can get into the driver's seat of your life and build the family of your dreams. We look forward to seeing you inside. Welcome to today's episode of the Building Your Family podcast. I'm so glad to have you here. So we're going to continue our conversation today about PCOS, but I thought it would be really helpful to talk about it from a patient's point of view, somebody who's been through it and somebody who knows a lot about it, because not only has she been through it, but she knows thousands of people who've experienced it and has had so many difficulties with it. Her name is Ashley Levinson, and she is called the PCOSgurl on social media. She has quite a following, and she's won many awards for her advocacy and for her volunteerism. She's done so much to help advance causes, support people, and spread awareness of this really difficult issue that affects so many people, and so many people, unfortunately, are very uncomfortable discussing. So we're going to break some myths today and help you feel less alone and help you get some really good information. So welcome, Ashley.
Hi, thank you for having me today.
It's my pleasure. I'm so glad that I found you, and I'm so glad that you're doing everything that you're doing for so many people. It's really incredible. I don't know where you have the time, but it's really appreciated by me, and I'm sure many, many others. So can we tell the audience a little bit about you and how you got to this place to become an advocate for PCOS?
Well, I can tell you, when I became a PCOS advocate, it wasn't on my bingo card. However, like most people who get a diagnosis of PCOS, I was in my late 20s and I was having trouble conceiving. I had gone off the birth control pills for the first time in about 16 years. So I was actually diagnosed at 13, but nobody told me what PCOS was or what it could mean for my future health or fertility. So at 13 years old, when I went and saw a doctor for irregular periods, he basically said to me, I'm going to give you these pills, stay on them, and when you're ready to have kids, come back and see me. That was it. That was my introduction to PCOS. And throughout my teenage years, I struggled a lot with weight, excess facial hair, acne, but it was overshadowed by the fact that when you go through puberty, you see a lot of those same symptoms. Mine just seemed to be a little more severe than most. And it was just chalked up to me having a hard time growing into my hormones. So fast forward until age 29, I was married and decided to have a family. Went off the birth control pills, and within a 3-month period, I put on over 100 pounds, and all of these symptoms started
Oh my
raging
God.
again, like the acne, the facial hair, the dark skin patches. I didn't know quite what was going on. My periods were irregular. I would go months without having them, and then it was almost like I hemorrhaged when I did have them. And, when I missed a period and I took a pregnancy test, I wasn't getting a positive result. So it got to the point where I said, there's something going on and I've got to figure this out. I started with my general practitioner and got gaslighted, was told that I was probably stressing out from trying to conceive and not being successful, and I'm probably overeating and oversleeping, and, which was the furthest from the truth. I had worked very hard to keep my weight in check and to, be a healthy 20 something. The only thing that had changed was stopping the birth control pills. So I went through probably about 5 or 6 more doctors telling the same story about the symptoms and going off the pills and all of these things happening, and I'm not getting pregnant. And it wasn't until I saw that 7th doctor, which happened to be a resident, and I walked in and I said, okay, I'm going to tell you my story. I've told it 5 or 6 times. And every time I'm told I'm crazy or I'm to blame, I'm not doing things right, I'm not eating right, I'm lying about how I take care of myself. So I told him everything and the symptoms. And he walked out of the room and came back in with a textbook and opened it to a page. And there were 4 letters, PCOS, that were at that point going to define how I moved forward with treating PCOS and advocating for it. From that moment on, I was so angry with the care and the time that it took to get a diagnosis. I said I didn't want anyone else to ever have to go through what I went through. And that's kind of what sent me on my path to advocacy with PCOS.
Oh, what a story. Well, I have to hand it to you because I think a lot of people would have stopped along the way and said, okay, I guess it's my fault. Maybe I'm really stressed about my fertility and that's what it is. And I'm not going to ask any more questions. And they just, pull the covers over them and just say, okay, I'm done. I'm doing something wrong. Or, maybe it's psychosomatic. I'm causing this. And so it sounds wonderful that you are able to not only advocate for yourself, but as a result, been able to help so many people. And so I think everybody out there should really take heed because it's so important to advocate for yourself. Although your doctors know a lot, they're people, right? And so there are some good lawyers, some bad lawyers, some good doctors, some not so good doctors, right? And so we have to keep advocating for ourselves and doing what we can. And I my hat's off to you for that. Really wonderful.
Thank you. It really taught me a lot about listening to myself and listening to my body and following my instincts, because an unfortunate part of PCOS, I had mentioned being gaslighted, and I hear that story repeatedly, that people are so desperate to find answers, support, and help, and they're just turned away. They're told exercise more, eat less, eat certain foods. And it's so much more than that. PCOS is a complex endocrine condition. It's not just cosmetic. It's not just about weight. It affects every part of your body hormonally, reproductively, metabolically, and even psychologically. And until we start addressing this as a full body issue and not compartmentalizing it into infertility or cosmetic or lifestyle, then we're going to continue to have people fall through the cracks.
Yes. And I think the truth is that not enough people probably know about it. And maybe many of these doctors, it didn't occur to them. So they just thought, oh, you gain weight. Well, you exercise and diet, right? And that's the end of the story. And so it's great that you were able to uncover this problem and start to treat it. So what happened after that? You found out this is what the story was. And what was the next step for you?
Well, I was told that I could go 2 different ways. I could either try to get my health in check with PCOS, or I could try to get pregnant. For whatever reason at that time, there didn't seem to be a way to do both. And I think it was just because of the limited knowledge at that point that my doctors had, and really society as a whole had at that time, because that was in 1999. So I decided that my main goal was to get pregnant, and I saw a reproductive endocrinologist. And after going through oral medications and then going through injections, I was able to conceive my first child, my daughter. It was a very tricky pregnancy. Through the first trimester, I had to use all types of medications to maintain the pregnancy. That's one thing that a lot of people are not aware of. You can get pregnant with PCOS, even though sometimes it may be a little more difficult than normal. But once you do get pregnant, there are a lot of risk factors. It is a high risk pregnancy. There's a high prevalence of miscarriage, of low birth weight, of early birth, of preeclampsia. So there are a lot of things that you have to be aware of. And doctors, again, need to be aware of the condition and how it impacts you once you're able to conceive. So I had my daughter, she was healthy, and then I went through the second route, which was getting healthy with PCOS. And I was very fortunate in that the area that I live in had the first PCOS center, which was a multidisciplinary practice in the city. And I saw the doctor there, Dr. Catherine Sharif, and, I began speaking to her about all my frustrations, and she understood me and saw me as a whole person for the first time in my life, and tailored a plan that was for me, for my needs and for my symptoms, which is another very important point. Not every person with PCOS is going to look the same. And the reason it's called a syndrome as opposed to a disease is because it can be any combination of symptoms. You can have one, you could have 10, and it also varies in severity from person to person. So each treatment plan has to be individualized. It cannot be just one blanket plan for everyone. So she got me healthy. I lost about 60 pounds and was doing great. And as a result of that, I got pregnant a second time with my son and had a very healthy pregnancy. And the thing that was interesting is without taking all of those medications, I had a much better pregnancy the second time round when my health was better and I was practicing healthy lifestyles at that point.
Wow, that's incredible. So, a couple of things. First of all, I think what's really important to kind of highlight for everyone out there, you hear Ashley saying it wasn't just a fertility issue, right? It goes beyond that. Unfortunately, I know nobody wants to think about that because it kind of gets bottled into this issue around your fertility, but it's something that you always have to take care of. So you want to make sure that you're mindful of it even after you build your family, right? You can't just kind of stop. And the other part is what you're saying, that everybody has to really consider, how does this show up for them? And just because they look on Google and say, well, I don't have every single one of these symptoms, doesn't mean you don't have it. You still may have it, and it's still important to make sure you check it out.
Oh, absolutely. There have been patients that are extremely thin that have PCOS.
Mm-hmm.
And a lot of times they'll go into the doctor and they'll say, I'm experiencing these symptoms and I've been told maybe I have PCOS. And they're basically told you're too thin to have PCOS. That's not correct. Because some people suffer from the androgen excess, which are like the excess male hormones like testosterone, and that may drive their symptoms or what they're going through. A person like myself that deals with weight issues, I have more of an issue with insulin resistance, which is another component of PCOS. So again, it looks different on everyone, and we can't, say, you're too heavy to have PCOS, you're too thin to have PCOS. It could be anyone, shape, size, color, anyone could have PCOS.
Yeah, that's incredible. And so then what? So you had now your second child, and then what did you do next? And how did you start to say, okay, I've got to take care of myself for the long term?
Well, I was seeing Dr. Sharif and at the PCOS Center, and we came up with a long-term plan because what she had told me is, a lot of people think that PCOS is a condition of reproductive age women, age 15 to 45, I think is what it says on a lot of websites.
Yes.
And that is so incorrect. And that's like nails on a chalkboard to me because you are born with PCOS and PCOS is with you until the day you die. It just looks different at different ages. And a lot of people think once you get pregnant and you're done that journey, that's it. You don't have to worry about it anymore because you're in perimenopause or menopause. But that's when the symptoms actually are at their worst. That's where you're at risk for high blood pressure, high cholesterol. There is a 7 times greater risk of heart disease. There is a 4 times greater risk of stroke. There is an increased risk for endometrial cancer. So, if we're not taking care of our hormones, that's going to impact everything in our body. And long term, it's going to cause some major consequences. So with Dr. Sharif, I told her about all of these concerns and I said, we've got to do something about this. How do we inform other people about it? And she also was an incredible advocate. And we wound up doing an episode for a show that's no longer on, but I know a lot of people used to watch it, called Mystery Diagnosis on Discovery Health Channel. And they covered polycystic ovary syndrome because it was considered a rare or a mysterious condition at the time, even though it affects up to 21% or 1 in 5 women worldwide, it was considered rare. So we did this episode and my life kind of exploded. I had so many people trying to contact me through social media and through email saying, oh my goodness, this is the first time I've ever seen somebody that is going through what I'm going through, has experienced the pain that I've experienced. And I said to myself, we're onto something here. And we have to keep speaking about this because there is a need for it. And organizations have been formed over the years and some have come, some have gone. Now we have PCOS Challenge, which is an amazing organization that does a lot of advocacy, a lot of support for patients. And I decided that's where I wanted to be, telling my story and helping other people tell their stories as well.
That's incredible. Imagine your beautiful future. You're snuggling with your child. You feel so connected to them. Your friends and family are so happy, and you have everything that you've ever wanted. I want this for you too, but I want more than that. I want you to feel secure knowing that you've made the best decisions, not just short-term, but long-term for your future family. Wherever you are on your journey, whether you're choosing a donor, choosing a clinic, learning how to talk to your donor-conceived child about their origins, all of these decisions will have wider implications for your future. And I want you to have the right resources so you can feel empowered and confident at this very important time in your life. That's why I'm so excited to introduce you to Building Your Family. It's the only expert-guided platform designed for parents and parents-to-be using reproductive medicine. We provide unique strategies that you won't find anywhere else to make your path to parenthood smoother and more informed. And that's why our approach is about offering practical and actionable steps that you can use right now. Whether you're just starting out or already deep into your process, Building Your Family is here to guide you with expert advice, specialized education, stress reduction strategies, and a community to support you every step of the way. We can't wait to see you inside. And so what happened then? Because I know you had some other health issues after that.
I kind of call myself the poster child for everything that can happen with PCOS because a teenager, I had problems with the weight up and down and with the irregular periods. In my mid to late 20s, I had problems with infertility. Then after my pregnancies, I started having problems with weight again, with the cholesterol that I was talking about, with the high blood pressure. And, that led me to a path where I literally became a PCOS statistic. I had a stroke not too long ago,
Wow.
which, over time, again, that can be a result of PCOS. I had abnormal uterine bleeding and had a hysterectomy, and that was in my perimenopausal stage. I had endometriosis. Now, I also battled breast cancer. Now, with saying that, there have been studies that have been done that link what goes on hormonally with like the estrogen and the progesterone that could lead you to a higher risk of cancer, but there's nothing definitive. No one has ever come out and said there's a connection between PCOS and breast cancer, even though there are studies that are being done on it right now. But to me, it just makes sense that that could have been a risk factor for the breast cancer.
And when did that happen?
I was diagnosed with breast cancer in 2023, and it took me 2 years of treatments. And in January of 2025, I finally could turn around and say that I was a survivor. So it's just this year that I started my survivorship with breast cancer. Since last year, I've started advocacy with breast cancer as well, because that's another condition that I think is also underserved and needs more funding and more support as well.
Well, I'm so glad that you're out there to support people. I'm just sorry that you had to do all these things in your life and had to suffer through so much to get to this place. It's been a lot for you, Ashley. What do you think that, because I know, you were out there talking to people who were calling you and you're on the internet a lot, and people are often asking questions about this. What do you hear most often?
Am I normal? Is this normal? Am I ever going to feel complete or whole or healthy? A lot of people feel like they get into a rut with this condition, that there is absolutely no hope. Again, because there aren't enough people that are knowledgeable about the treatments. There is no known cause for PCOS. There are no treatments that are targeted for PCOS. Every single treatment that is currently used is off-label. There is no FDA-approved treatment for PCOS directly. So
Really?
birth control pills, insulin sensitizers, GLP-1s, those are all off-label. And a doctor has to be knowledgeable enough to know that these treatments, while they're not directly for PCOS, are effective in helping PCOS. Also, I talked earlier about treatment being multidisciplinary. So medications are a great start for a lot of people. A lot of people also need help with lifestyle. So there are trainers that specialize in PCOS. And another really big component is nutrition. So talking with nutritionists about PCOS that understand what you can eat, what you can't eat, and how your body processes things. So really that's the crux of it, is people just want to feel normal. They want to feel accepted and they want to feel heard. And that's where I step in, and I try to be a bridge between the medical field and patients to try to marry them to help them get the support that they need.
And so when you see people on the internet and they write to you and they say, "Am I normal? What's wrong with me?" It sounds like there's so many things to do, right? There's just so much to do. It seems a little bit overwhelming. You have to see a specialist, you have to take medication, you have to think about exercise and diet and lifestyle and probably stress management and all of that. And so, how do you advise people to get started?
My advice is finding a community. Google is great for certain things, but it definitely does not have a medical degree. So I
Hmm.
wouldn't rely on it heavily. If you go to community, either people like myself that put themselves out there as advocates for the condition, or on Facebook, there are groups where you can go in and talk to other people that have gone through it and have gone through treatments. Doing research that way with people who have lived experience, I think is your best start. That was my best start. I found message boards and a bunch of other women who were talking about all these symptoms, and we all started saying, "Oh my God, I have that. How do you treat that? How do you do that?" And that's when we also realized that coming together as a community was powerful and was a way to help other people get treated and get heard. Start there with the community and make sure that there are people that are referenced, make sure there are people where you're reading good comments if you're following them on social media, or that they're responsive in a responsible way, because you will also find there are a lot of social media accounts that are there for a reason to sell things. And the PCOS community is a very vulnerable community. And because we don't have those approved treatments, people are going to try to push a lot of different approaches and a lot of different treatments that they shouldn't be pushing. So educate, research, and then, ask people to help you find the right doctors in your area, and then go see somebody who is a PCOS specialist.
I'm so glad you said that, Ashley, because that is one of my pet peeves is that certainly in the world of fertility treatment, we see so much misinformation and so many people are vulnerable and they will do anything. They'll drink snake oil if somebody tells them they can get pregnant with a yoga pose or by thinking differently or whatever it is. And of course, we all want to control what we feel is out of our control, right? And so we naturally will say, okay, well, that sounds good. This person got pregnant doing this thing. So I'm going to try it. But, first of all, we don't know if it's true. And secondly, you're not that person. You may have a completely different makeup or diagnosis. And so, can you give us some idea to help people get on the right track? What sorts of things should they be looking for? Maybe you can share some of the symptoms with us and tell us a little bit about how it affects your body and what to think about. So if people are out there and thinking about, do I have PCOS? What are some of the telltale signs?
Well, a few of the really well-known symptoms of PCOS: irregular periods. So if you're having less than 8 periods a year, or you're having periods which have a break between 1 to 3 months between your periods, then that could indicate that it's PCOS. PCOS is the leading cause of menstrual irregularities. So
Hmm.
that's something that you should discuss with your OBGYN or your GP if you are having the irregular menstrual cycles. Weight gain is another condition. Even in teenage years, insulin can build up very quickly, and a lot of people that can become insulin sensitive and insulin resistant in their teen years, in their 20s. So if you're struggling with weight, that's another telltale sign. Also, for people that may not have an issue with weight, but they're noticing skin changes like the acne, like the excess facial and body hair, that's usually a sign of androgen excess. And that is also another telltale sign of PCOS. So those are really the main signs to look for, but there are so many because it affects so many different parts of your body, that if you feel anything is off, discuss it with your doctor.
And people very easily dismiss it too, right? They say, well, I skipped a few periods, so what? Or, their doctor may even say that. But lots of times people don't really get on top of these health conditions because they just want it to kind of go away. And certainly when we're trying to get pregnant, we can't waste time. Our ovaries get old. And so we really need to make sure that we're on top of these things. So it's really essential, I think, for everybody out there to kind of think about, well, is this one of the things that could be affecting me? And if so, can I talk to my doctor about it? And what sorts of things can I change and will be different? So, what sorts of things do people do that can change their health? What sorts of exercises or foods should they think about including or avoiding?
Thank you for asking that. One of the things, because since you mentioned exercise, I'll start with that. A lot of people, especially if they are dealing with weight issues or being told by their doctors, you need to lose weight, the first thing you want to do is go to the gym and start working out as hard as you can. But that's not necessarily a good thing for PCOS, because it raises cortisol levels, it raises your stress, which also affects your insulin, and can make you more resistant if you're working out too much. So it's balance, doing things more like walking, doing low impact exercises, yoga, aerobics, things that deal with muscle and building muscle, because muscle helps battle insulin and insulin resistance. So talking with somebody who is a PCOS trainer, and there are some wonderful ones that I work with and that I've done posts with, that if people went on to my page, you could find some of these PCOS personal trainers. That's a really great start. Also, nutrition, not necessarily nutrition in the sense of diet or starving your body, because that's not really good for anyone. And that's definitely not good for PCOS. It's more about eating the right foods and knowing what those foods are. So talking with somebody who's a PCOS nutritionist, again, I have done a lot of lives and podcasts and posts with a lot of these PCOS nutritionists that are amazing and have helped people change things around tremendously. Last thing is lifestyle as far as stress. Stress is a big factor with raising androgen levels and insulin levels. So doing things like meditation, again, like yoga, things to lower those stress levels, and just to help you live a healthier and happier lifestyle are going to make a big difference with PCOS.
That's great. I mean, it's good to know that there are things that we can do because, of course, certainly when you're going through fertility treatment, you feel so powerless. And I'm sure if you have PCOS and it's been dismissed, you feel powerless also. So it's so helpful to think about, well, there are all these things I can do that can help me, but also not to feel overwhelmed because, as you're saying, there are experts out there who can look at your case very individually and say, okay, this is the right recipe for you.
Absolutely. Absolutely. And, the other thing is not to look for instant results. A lot of times with PCOS takes time for your body to get into a certain state where you're dealing with, trouble with losing weight or irregular periods. And it's going to take your body some time to adjust to a new lifestyle. So remember to give yourself grace. You are not broken and you will get to where you want to be. You just have to give it some patience and some faith.
Hmm. Yes. We all need patience, right? We want it done. Once we decide we want it done yesterday. But I would imagine it probably takes several months at least to start seeing some sort of result.
Absolutely. I mean, some happen a little faster as far as like regulating the menstrual cycle, especially if you're taking certain medications to help regulate that menstrual cycle. Birth control pills can be a great way to do that, to help with a lot of the symptoms. But you have to keep in mind that it also masks a lot of the symptoms. So if you're trying to see whether or not you're healthier with being on birth control pills, you actually have to go off birth control pills for at least 3 months before you can see whether or not they're making a difference when they're running like
Hmm.
blood tests and everything. That could be a wonderful tool. There are a lot of people that don't want to put those medications in their body. There are a lot of natural alternatives. There is a supplement called inositol, which a lot of people with PCOS use that and say that they've had remarkable results. But again, just as the symptoms and the severity of the symptoms can vary, so can the treatments. So it's kind of wait and see with a lot of it.
So you have to try on maybe a couple of different things and see what works for you.
Absolutely.
Well, that's very helpful. Thank you so much, Ashley. This is really helpful information. And I hope not only out there that you feel that it's helpful, but also that, the stigma is being lowered here. We really want to lower the stigma and get good information out there. There's no shame in this. And it's really important to identify what the issues are. So, as we wind down, are there things that we haven't covered, things that you think would be helpful for people to know?
One thing that I always like to talk about is advocacy, not just for the community as a whole, but for yourself. Getting involved, being present, and being part of something that's bigger than yourself is very cathartic. It can also be part of the healing process because you're all working towards a common goal, which is better understanding, more support, and more research for the condition. So I encourage people to get involved. Every year we go down to Washington, D.C., and we actually were able to sit down and talk with our legislators about PCOS and that we need more clinics in a certain area or more treatments through, the National Institutes of Health or the FDA. And we encourage them to help us raise awareness and help us raise funding for the condition. September is PCOS Awareness Month. We have buildings around the world that light up. Last year, we had over 650 buildings worldwide and landmarks light up teal for PCOS for September 1st, World PCOS Day. So go to one of these locations with a bunch of friends or other people in your area that have PCOS. Again, engagement, really important to feel part of something and be part of something.
Yes. And it's so empowering and to feel like you're doing something positive when you can feel so diminished by this.
Absolutely. Absolutely. It was a big part of my healing journey was finding support and comfort in the arms of my fellow community members.
It's great. Well, you have certainly been a voice for change and have been contributing to that. So I want to thank you, Ashley. It's so wonderful, everything you're doing. I really appreciate it. And I appreciate you coming on today. It was so nice to have you.
Thank you so much. I really enjoyed the opportunity to talk about PCOS from my perspective and from the patient's perspective. And I hope it'll help a lot of people moving forward.
I'm sure it will. I'm sure it will. And where can people find you?
I am on Twitter, Instagram, and Facebook under PCOSgurl, which is PCOSgurl, just because I had to be a little fancy. So anybody can find me through the social media, message me if you need help, and I will do my best to help and guide anyone who needs it.
That's very nice of you, Ashley. That's wonderful. Well, thank you so much for your kindness, for your warmth, and for all that you're doing for the community. I really appreciate it. And I really appreciate all of you out there who've sat for this talk because I think it's so important to make sure that you cross your T's and dot your I's and advocate for yourself and see if PCOS is part of the issue that you're facing. So I hope you enjoyed this episode, and I can't wait to see you next week. Thanks for your time. Thank you for joining me today. I hope this was helpful to you. And if you'd like more personalized support, more information, and more education, you can find it in the show notes under the Building Your Family community. We'd love to see you inside. And if you were interested in today's topic, you will really like this video.